Today I'm going to be teaching you how to use Therasol oral antiseptic rinse along with a gum stimulator. And what you will need is Therasol, a gum stimulator, also known as rubber tip, and a medicine cup. And I have about a teaspoon of Therasol in this medicine cup. Therasol is a great antiseptic rinse. It's non-prescription, but it is professional strength, and it's an antibacterial agent. Now, some dentists will recommend it for periodontal disease. Others will recommend it if you're undergoing intensive dental treatment to assist the gum tissue in the healing process. I'm going to dip the rubber tip into the Therasol, take it to the gum line at a 45-degree angle, and follow the gum line. You go underneath the gum line, up and around the gums. You dip into the Therasol again, go underneath the gum line at a 45-degree angle, feeling the rubber tip going underneath the gum line, following the gums, and then you dip again, and you go around the gum line, underneath the gum line, allowing the rubber tip to gently clean underneath the gums. And you will do this all the way around the gums. You will follow the gums underneath the gum line all the way to the back, allowing the rubber tip to gingerly clean underneath the gum line. You'll do the same thing on the inside of your gums. Inside's always going to be a little more challenging. Don't get frustrated if you fall off track. Just take your rubber tip and pick up where you left off. Again, following the gum line, allowing the rubber tip to gingerly go underneath the gums. The rubber tip is stimulating the gum tissue, sort of massaging it at the same time, and it's lifting any debris that your toothbrush may be missing. Going underneath the pockets, you'll see how sometimes you're picking up some debris. It's okay, you could take it, rinse it, wipe it on a towel. Just like that. You're going to do this all the way to the back. You could do it once or you can do it twice, whatever you're more comfortable with. But once you've did that, you move to the top teeth. Again, it's hard to see here, but you are going underneath the gum line, starting the very back, dip, rubber tip, dip, rubber tip, stimulating the gum tissue, removing any debris that is underneath the gum line or in between the pockets. Just like that. Always dipping your gum stimulator or rubber tip into the Therasol. Just like that, all the way around. You're going to feel the rubber tip actually go underneath the gums, and you're going to sweep all along the inside too. Inside is very important because you have pocket tissue back here too. It's the hardest area for most people to clean with their toothbrush or floss. Now that you have finished using the rubber tip along with the Therasol, you will notice that you have a lot of the Therasol left over in your medicine cup. We do want you using the remaining of it by rinsing with it. You want to rinse with it for a total of 2 minutes, and I know it seems like a long time, but that is the recommended amount of time so that your gums can benefit to its fullest. So you'll want to take the remaining of the rinse and rinse with it only if you are finished with your hygiene routine. So if you have chosen to use the rubber tip before brushing and flossing, you would want to continue with brushing and flossing. You would rinse out with your normal rinse or water and use the Therasol rinse as a final rinse. Do be advised that the rinse does foam, so when you're rinsing that long of a time or swishing that long of a time, the rinse will foam and it almost makes you feel like your mouth is going to blow up, but I promise it won't. So that is how you use Therasol. Your gums are on their way to getting much healthier. Congratulations!